Fibromyalgia is a chronic disorder characterized by widespread pain with no known cause. It can be difficult to diagnose and even more difficult to live with because many patients feel their pain is unmanageable.
My name is Maggie and I have had fibromyalgia for over 10 years. It started off as chronic leg pain and nothing seemed to help. And then, just as suddenly as it appeared, the pain went away. A few years passed, I started getting headaches, chronic pain in my hips, my arms, my legs, my joints, and even in my big toe. X-rays showed no problems with my hips, and tests proved negative for gout, arthritis, and even MS. I was diagnosed with fibromyalgia after seeing a rheumatologist and a neurologist. Because of my constant pain, I can no longer do all of those wonderful things I used to go do, even visiting my children. It's just awful because people don't understand. And it's been going on for so long that people think I'm making up my symptoms. It's very frustrating because there's a lack of information regarding fibromyalgia. I would like some relief and some answers.
And I want to thank Maggie for sharing her story with us. And back to discuss why it's so hard to figure out fibromyalgia is Dr. Frida Lewis Hall, Chief Medical Officer of Pfizer. Welcome back.
Thank you so much. Always great to be here.
So, a lot of confusion surrounding fibromyalgia. It's frustrating, it's misunderstood, and it's multifactorial. It's thought to be a disorder of the central nervous system, which causes the person to experience amplified pain due to abnormal pain processing in the brain.
Unfortunately, Maggie's story is not uncommon. We estimate that there are about 5 million people, adults in the United States, who suffer with fibromyalgia, and women much more often than men, about 6 times more often than men. And it is often the case that it's first diagnosed around another condition in which there is pain.
And I was talking about how it's misunderstood and individuals experience this chronic, widespread pain. Tell us more about that.
It's not just pain, it's also tenderness to the touch. So it's a combination of that and other things. And like Maggie explained to us, these symptoms are, they move around a little bit. They're unpredictable, they're hard to describe, and they come and they go.
And with fibromyalgia, it can occur with other conditions like you mentioned, osteoarthritis, rheumatoid arthritis, even things like lupus. A rheumatologist, as in Maggie's case, may help make the correct diagnosis. One tool that doctors do use to diagnose fibromyalgia, it's known as a tender point examination. So what this exam consists of is pressing on various points of the body. You see them here. If 11 of the 18 areas cause tenderness or pain, a fibromyalgia diagnosis might then be made.
Absolutely. And then there are other tools that can be used. There's a standardized tool, for example, an assessment tool like a questionnaire. And it helps to understand both the extent and the severity of the pain and the symptoms. Now, fibromyalgia is often characterized by, first of all, 3 months of pain. And then again, the pain is widespread. What does that mean? On both sides of the body, left and right, and above and below the waist.
Fatigue can be a common symptom, waking, feeling unrefreshed. Even when sleeping for long periods of time, that can be a red flag. Impaired memory and concentration, dry eyes and mouth, mood disturbances, stiffness, irritable bowel and bladder, pain or cramps in the lower abdomen, headaches and migraines are also commonly associated with fibromyalgia. So a constellation of symptoms.
Yeah, it's a lot. Maggie has shown us how complex and distressing this disease can be. You've told us how complex medically this disease can be. So what do you do when you're diagnosed with fibromyalgia? Well, the disease is a little bit different in everyone. So first and foremost, it's making sure that you're together with your doctor and your whole healthcare team to put together a comprehensive plan that is designed for you. And there are tools that are available to help in the management of fibromyalgia. Supportive and cognitive behavioral therapy, medications, light aerobic exercise. So all of these things can be considered as a part of the plan. And if someone wants more information about fibromyalgia, they can visit gethealthystayhealthy.com.
And of course, you can also visit thedoctorstv.com. Maggie, thanks again for sharing your story.
Thank you.
All the best. Dr. Lewis Hall, as always, a real pleasure. Let's see what's coming up.